Good morning. A warm welcome to all of you. We have successfully completed our 3 days workshop, CME, and yesterday, and paper presentations. Today is the last day, and we begin with the guest lecture of Honorable Vice Chancellor of Tamil Nadu University, Dr. Sashayan. She is there with us, and we are anxiously waiting for her to begin. Before that, I just want to inform everyone that after the guest lecture of Dr. Sudha, we have paper presentations, the oral presentations, 3 sessions, and there is a break, a lunch break. And after that, we have 2 sessions of poster presentations. And in the evening, once they finish, we have a small tour, virtual tour to our anatomy department, and then there is a valedictory function. So before I begin, I hand over the mic to Dr. Nikhil Agrawal, who is going to begin the session. I congratulate everyone and acknowledge your presence, gracious presence in this guest lecture. Dr. Navbir, I can see Dr. Ghatak, Dr. Anu Sharma, I can't see, but acknowledging the presence of all of you, I really congratulate and wish that it's going to be a wonderful day ahead. I hand over the mic to Dr. Nikhil Agrawal.
Good morning, everyone. I am Dr. Nikhil, working as a senior resident in the Department of Anatomy, KGMC. I'm here to welcome you all. I can see our respected dignitaries for this session online. So let's move with the session. First of all, I would like to introduce the moderator of our guest speaker session, Dr. Navbir Pastrija ma'am, who is the additional professor at Department of Anatomy, RML, Lucknow. She is pursuing the FAMER Fellowship from CMC Ludhiana 2020 to 2022 batch. She was recently awarded the Best Researcher Award, also awarded for the International Scientist Award. She is actively pursuing medical education as a resource faculty, and she is also a member of the Society of Clinical Anatomists and American Association of Anatomists. I welcome Navbir ma'am. Ma'am, please unmute yourself.
A very good morning to and pranam to all the respected anatomists from all over India. It's my proud privilege to be the moderator for this session and to be introducing and welcoming our chairpersons. I would like to welcome our first chairperson for the session, Dr. Deepti ma'am. She's an anatomist who needs no introduction in the world of medical education and anatomy. Presently, she's working as Deputy Dean at Vinayaka Missions, Kirupananda Variyar Medical College and Hospitals, Salem, where she was also working as the former professor and head in that same department. She's also presently the President of Association of Anatomists, Tamil Nadu, former Editor-in-Chief of National Journal of Basic Medical Sciences. She's on the editorial board of the National Journal of Clinical Anatomists, the journal for SOCA, and she has been a voracious, much sought after guest speaker and resource persons in India and abroad for various conferences of anatomy and medical education. A very warm welcome to you, ma'am. The next chairperson I would like to introduce is Professor Dr. Surajit Khattak, who's working as a professor and head at All India Institute of Medical Sciences, Jodhpur. He has served the Indian Army at various capacities for more than 24 years, and he's also the recipient of the Western Command, the Army Commander Western Command Commendation in 2009 for his outstanding work at the Army College of Medical Sciences, New Delhi. He's authored 2 books. He's a fellow of International Medical Sciences Academy and Royal Society of Biology. He's a member of various international organizations, and we know that he's also a very well sought and well acclaimed anatomist. A very good morning to you, sir, and welcome to the conference. Our next chairperson is Dr. Anu Sharma, who's working as professor at DMC Ludhiana. And she's also done CMC, FAMA from CMC Ludhiana. She's the editor-in-chief of IGCAP and NGCA, so honorary faculty for the Department of Education and International Chair in Bioethics. She's a life member of various societies and has various achievements under her belt. Welcome, Dr. Anu. And I would request you to please introduce and welcome our guest speaker for the session. Thank you.
Ma'am, please unmute yourself.
Yeah. Good morning, everyone. Thank you, Dr. Navbir. And it is, I must congratulate, first of all, to begin with, to the whole organizing team who's doing a wonderful and fantastic job for this NatCon. And moving along, I would, it's my great pleasure to introduce Vice Chancellor, Dr. Sundar Sashayan. She is a Vice Chancellor, Tamil Nadu University, MGR Medical University, Chennai. She is a medical doctor, medical teacher, and administrator. She has served in the international advisory and editorial boards of Grey's Anatomy. She has edited a textbook of anatomy in 3 volumes. She has many laurels to her credit, and she has been the first publishing and compiling editor of the translated version of the Britannica Concise of Encyclopedia in Tamil. So, and moving along further, she's, apart from medicine, her interest lingered into spirituality, history, and literature. Her discourses are varied topics like Lalita Sahasranama, Vishnu Sahasranama, Saundarya Lahari, and she has earned a wide acclaim for all these achievements which she has done. She has been a quiz master and has compiled a few quiz books as well. She has had the privilege of translating former President of India, APJ Abdul Kalam's book into Tamil, and has also had the honor of getting it released by APJ Abdul Kalam himself. A very warm welcome, ma'am. We are looking forward to your great session. Thank you. Thank you. Over to Dr. Sudha.
Ma'am, please unmute yourself.
Thank you very much. At the outset, my very sincere thanks to the organizers for inviting me to be a part of this 68th NatCon, and also accommodating my request to reschedule my event. Respected chairpersons, Madam Professor Shastri, Professor Ghatak, Madam Professor Sharma, moderator Madam Paschiricha, the Master of Ceremonies of the session, Dr. Nikhil,
Thank you, ma'am.
respected delegates who have joined, participants from various cities and towns and medical institutions, and friends. I would request the organizers and the admin to kindly permit me to share my screen.
Yes, ma'am. We are just doing that.
Yeah, please.
And please begin sharing your screen.
No, I think you would have to permit.
Ma'am, done. Already permitted you.
No, by only my
Please,
whiteboard comes in. Okay. So let
And there are
me,
two options when you go for the share screen. There are two options.
let me. Can you see?
Ma'am, whiteboard is visible. Ma'am, you just stop sharing your screen again. When you get the option, there will be an option of your slide. PPT will be visible to you in front of you. Click on that rather than the whiteboard. It will just show up.
I'm going back. Yeah.
Yes, ma'am. Now your screen is visible. Just open the
Yeah. Is
PowerPoint.
that fine?
Yes, ma'am. Just open the PowerPoint now.
Yeah. Can you? I've opened it, and to me it says screen is being shared.
No, ma'am. Actually, the folder which you have opened, that is visible. Ma'am, can you just close this folder? The Finder folder which is visible.
Is
This folder, ma'am. Just click on the red on the top left corner. Just click on the red
Yeah.
button. Yes, ma'am. Now just open the PowerPoint presentation and again.
now is it open? Is it open?
Ma'am, your screen sharing has stopped now. Please click on the screen sharing and now the PowerPoint will open, ma'am, when you will click on the PowerPoint. Again, a whiteboard is visible now.
Yeah, that is it. It keeps saying only whiteboard. I think you will have to switch off the whiteboard so that I can. My share is open.
Ma'am, just wanted to ask you the presentation which you are going to give. Is that presentation maximized? Window is maximized on your desktop?
Yes. Yes,
Okay.
it is.
Then it should display.
Let's try.
You're requesting remote control. I've given you remote control.
Exactly, ma'am. Yes, we are trying to do it from our end then. Just accept the request for the remote control.
I've approved your remote control request.
It's still not sure. Ma'am,
Ritesh Kumar is controlling my screen.
correct. Yes, ma'am. That's my tech team here. Yes, ma'am. Ma'am, can you just close the share screen again? 1 second. For 1 second, just close the share screen.
Yeah, shall I say stop share?
Yes, ma'am. Please do it once.
Yeah, I've done that. Yes.
And now, ma'am, just
Once again, share screen.
yes.
Once again. There are two screens open. I will
Close the other one, ma'am. Yes, now it's perfectly visible. Yes, ma'am.
Okay. Yes.
Please go ahead with the presentation.
Yeah.
Yes, ma'am.
Fine. Thank you very much, and extremely sorry for this technical delay, and also extremely sorry to all the chairpersons and the delegates for requesting for a reschedule from yesterday. And kindly pardon to a bout of sneeze or a cough in between. I'm trying to control and be with you all. For this morning, when the organizers kept on asking me for a topic, I thought I would not talk anything specifically in the realms of anatomy. For all of you are experts in the area, and it would be redundant if I try and tell you something within the regions and within the structures. But then I thought it is high time that we share our ideas about the existence of an anatomist. The seniors here would probably agree with me when I tell you the breed of anatomists is slowly becoming extinct and we are endangered. Probably we need to think of our own existence and rejuvenate ourselves as a clan, as a group. And that is why I thought I would share my views on the topic, the anatomist at the crossroads. We're not very sure as to how we proceed. Do we proceed or do we take a U-turn and go back? And pranams and greetings to all of you. As a science and a discipline of science, anatomy has been the most significant and the best discipline to contribute to the growth and development of mankind. And once again, as a science and a discipline, anatomy has fascinated many scholars for centuries, for millennia. And once again, anatomy is yet to be completely explored and does bring lots of surprises even today. Now, if we take each of these one by one, anatomy is yet to be completely explored. And what do I mean by saying so? Till now, we have about 200 and odd cell types which have been identified in the human body. Yet all of us know there are some more types which are not even known, leave alone not being studied in full, but there are certain cell types which are not even known to us. There are so many surface mechanisms of the cells which are to be completely studied. Cellular interactions, though every day there are advances in the interactive mechanisms, there is so much left. And at the gross level, so many fascia. We talk in terms of fasciae, talk in terms of superficial, deep, and so on. But if we introspect our own cells, we'll understand fascia is one area which is generally kind of circumvented in the normal teaching of anatomy and normal thinking of the anatomical process. That's all, after all, fascia. But then there is so much to be realized in the zone of the fasciae and the facial compartments. Reactions of cells and organs to various organisms. The recent pandemic has made us understand that the receptor mechanisms, the reactionary mechanisms of individual cells to the organisms are yet to be studied. And all this is part of anatomy and so much left out. Now coming to the components proper, it is boastful that very often we say we know about the number of cells which are present in the human body, about on an average 37 trillion cells. The blood vessels of an adult run to about 1 lakh miles. And then there are about 640 named muscles. There are so many unnamed of them and many more. But is that all? There is so much in anatomy, in human anatomy alone, that requires to be analyzed and studied. Coming to the second aspect, anatomy has fascinated many scholars around the globe. across temporal lines, across spatial lines. Leonardo da Vinci, there had been several Michelangelos, there had been several Sushrutas, there had been several Vesalius who have been fascinated, artists, sculptors, philosophers, innovators. I say innovators and designers because everything under the sun requires contribution from anatomy. You talk in terms of ergonomic chairs, ergonomic furniture. Without human anatomy, none of this ergonomics would work out at all. You talk in terms of drapery. Without anatomy, drapery, newer designs, newer styles will not work out at all. So everyone under the sun requires contribution from anatomy. If a tailor will have to be a good tailor, good sartorial designing will have to come from the knowledge of anatomy. If someone will have to innovate on certain gadgets, even electronic gadgets, it requires a knowledge of anatomy. And that is why anatomy keeps fascinating everyone, even today. And as that science, which has contributed to the growth and development of mankind, anatomy has no comparison at all. Why was mankind made superior to others? Why is it that humanity had been able to control the rest of the world? Humanity had been able to control the plant kingdom, the animal kingdom, the forests, all because of the anatomical nature that was accorded to the humankind. Bipedalism made us superior to others. What the giraffe had to do by an obtrusive extension of the neck, mankind was able to do very naturally, primarily because of the erect posture. The erect posture gave us the advantage of the neck, the advantage of the binocular vision, by which the early human beings were able to see the forest, evaluate the forest, and develop a zone for themselves. And domestication of animals became possible, and man was able to control his atmosphere and his environs. The same bipedalism and freeing of the forelimbs has contributed to human civilization. Can we think of civilization without the use of tools? Whenever our history textbooks talk about human civilization, civilization along the Nile, civilization along the Euphrates, civilization along the Sindhu, and then the invention of the wheel, invention of the tools, the old Stone Age, new Stone Age, Iron Age, Copper Age, all that came into existence primarily because of the freeing of the forelimbs, the prehensile mechanism, the grip mechanism, and so on. And across languages, you find it is this grip mechanism that has gained acclaim. If you take the English language, we have words like manage, management, menagerie, mankind. And where did all these words derive themselves upon? Manus. We all know where the manus is. And what has been performed with the manus has given us a horde of literary words like manage and management. Today we say management, and we think management is not related to anatomy. But then if you think of the word, how this word management came upon, it came because something was performed with the manus. And from there, every human activity is related to manus and management. The same is true with every other language. I've just given examples from 2 languages of the Indian territory, Krityam in Sanskrit and Seyal in Tamil. Those of you who are familiar with these languages, what you do with the chain has become Seyal, and what you do with the karam has become Krityam. I'm trying to emphasize on this to make all of us understand that across the globe, everything that humankind had been doing has become possible primarily because of the factors of human anatomy. And anatomy has led to intelligence. the development of forebrain, the development of the various faculties of the forebrain, the recent and remote memory stock, which are not that very developed in the animals, zones like associative thinking, all this has led to what is called intelligence in the mankind. And this intelligence today is evolving into artificial intelligence. Once again, the device and the design of mankind. Artificial intelligence, machine learning, deep learning, all that is becoming part of the globe. And please remember, all this depends on the understanding of human anatomy. Without the understanding of human anatomy, no AI is possible, no deep learning gadgets are possible. But with so much of anatomy and its significance behind, how much has the anatomist derived from this? What is the significance that the anatomist has got today in the eons of 2022 and the 21st century? The anatomist is still standing at the crossroads, not knowing as to what direction to take, whether to proceed further, whether to turn right, turn left, or, as I told you earlier, take a about turn and go back. Leave the discipline of anatomy. I'm a little pained when I hear my junior colleagues tell me, ma'am, should I continue in anatomy? Anatomy has no future at all. Friends, very often in the medical institutions, we have heard people say anatomy is a dead department. Primarily because we deal with cadavers and we teach the living with dead material. And very often, junior anatomists are pushed to the extreme to take a decision as to whether they should continue in anatomy or migrate elsewhere. Why this status? Anatomy is often considered dead. But today, I would want all of us to understand anatomy is not dead at all. Anatomy can never be dead. Therefore, to save the breed of anatomists, I believe a conference is there for us to exchange views, interchange our knowledge, disseminate our knowledge, at the same time, also think collectively for the betterment of our own selves. To save the breed of anatomists, what can we do? Practice living anatomy. I have been an anatomy teacher for about 3 decades of my life. And I think we have come to a stage where we no longer can be teaching whatever has been there in the older textbooks. We would have to emphasize on areas like facial anatomy, fixation anatomy. So many cosmetic procedures have evolved in the last 1 decade, and we find fascia plays a major role in these cosmetic procedures. Take fascia from somewhere and put it across in another place to build an appearance. Similarly, with so much of transplantation coming into vogue, fixation anatomy, fixed procedures, urogynecological procedures, urological procedures, fixed structures, and therein all that tissue we thought is not at all important. All that tissue your first MBBS candidate would just scrape from the cadaver and throw on the table. All that tissue which your anatomy attendants would be kind of collecting and putting in the dustbin, that tissue gains importance. And we as a breed will have to concentrate on this living anatomy. Learn more about
Apologize to everyone. Maybe there is some network problem from ma'am's side. We are trying to reach her back. Ma'am, there was some network issue on your end, I guess.
I think there was some network issue. Can you hear me now?
Yes, ma'am, definitely. It
Yeah,
happens
I would again
sometimes.
share.
Screen
Is it fine
sharing.
now?
Yes, ma'am, we can see you. Ma'am, please click on the slideshow.
Yeah. Is that fine?
Yes, yes, ma'am. Please go ahead. Thank you.
Yeah. So as I was telling you, it is necessary that we emphasize our teaching, our techniques, and probably, make more of living anatomy part of the system. The other thing that we would have to do is to concentrate on interdisciplinary studies. Now, when I say this, I do not mean that there are no studies as of now, but then probably we would have to migrate a little more and then become more inclusive. I remember the days when my surgery professor, as I was a student in anatomy, a postgraduate student in anatomy, I remember my surgery professor would always call me to the theater and make me stand next to him as he was operating. It was a kind of a mutual learning. He would learn anatomy from me per-operatively, and then I would learn as to what the living structures were. What Anson McVay told or what any other clinical anatomy book told was nothing comparable when I saw that in the theater per-operative. So I believe that kind of a system will have to be evolved again. We would have to bring in officially a kind of a system. Of course, our postgraduates are posted to the surgical theaters, surgical wards and all that, but then we'll have to make the in-house learning process come into force, wherein interdisciplinary learning would make more of living anatomy possible. And when I talk about interdisciplinary studies, I also mean something else. For example, how much of dance anatomy do we know? There had been emphasis on sports anatomy in the last 2 decades. 30 years ago, people did not think that anatomy would be required for the athletes and sports medicine practitioners. But then, last 3 decades, we have seen so much of anatomy required, learning of anatomy, knowledge of anatomy required for someone to practice sports medicine. Similarly, how much of dance anatomy do we know? I've just given you on the screen a picture of a textbook on dance anatomy. But then that relates to the Russian style of dancing, the Western style of dancing, and so on. But then when you compare the Indian style of dancing, there are so many areas. The Bharatanatyam, what is the joint position? What is the kinematics in the Aramandi and the Murumandi of Bharatanatyam? What is the kinematics in the Kathak postures? Now, these are all areas where anatomists can explore so much and make interdisciplinary work possible. These are just examples. I'm not giving you an exhaustive list. I'm just pinpointing at small examples where we can start working. Similarly, expand on investigative and diagnostic areas. Now, this is a little tricky and touchy. I know I'm touching a very sensitive zone. Years ago, some of my own colleagues in anatomy had been practicing ultrasonologists. They had practiced ultrasonology, they had practiced investigative radiology. But with changing scenarios, with several laws and regulations coming into force, whether we would be permitted to do that, I'm not too sure. The anatomist can be an investigative radiologist, cross-sectional anatomy, radiological procedures, imaging techniques. The anatomist can contribute so much in the investigative procedures. You don't have to become an interventional radiologist. Probably radiology, if you try as an example, the anatomist can be the non-interventional radiologist performing only the investigative part, performing only the analysis of the various procedures, the analysis of the cross-sectional and the radiological anatomy at that point of time. And the intervention can be taken up by the clinician or the radiologist. But I know I'm treading a very tricky zone here. I'm not too sure if my radiology colleagues would accept this, would even relish this kind of a thinking. But collectively, probably all of us can put in our intelligence and think of certain areas where the anatomist will not have to be a dead anatomist, but then think in terms of living anatomy. Friends, these are certain areas which I'm trying to identify so that all of us can work toward. And I sincerely believe anatomy can never become extinct. As a discipline, anatomy can never become extinct, and anatomists can also not become extinct. 2 days ago, when I was not that very well, it so happened that I received a mail from one of my students. I do not even remember if she was my student. She has identified herself as one of my students way back in 1989. You can imagine, those were the days when we did not have these many gadgets. And probably I was one of the junior staff members of the department, and probably a little closer to the students, because generally the junior staff members are closer to the student batches. And then here she writes to me, thanks me profusely, somehow trying to find my mail ID and write to me. The reason she tends to thank me is that she was able to identify and diagnose a particular disease in a patient. And what was that? That was subclavian steal syndrome. And she says, ma'am, way back in 1989, one day in the class, in the practical demonstration class, in the dissection hall, you taught us subclavian steal syndrome, clearly explained as to what happens in subclavian steal. And years later, when a patient complained of certain cured headache phenomena, I was able to relate that and then diagnose subclavian steal, which many people had failed to diagnose. And then she sends her note of gratitude. Friends, when most of us chose anatomy as a discipline for ourselves, we that we would become teachers of anatomy. We would become medical teachers. We would breed a lot of anatomists, and we would also breed lots of other specialists who would be coming out of the institutions in which we teach. And the pride and the privilege that a teacher has is unique. Wherever you are, years later, decades later, there is someone who's your student. And that is a pride that an anatomy teacher has. So anatomy can never become extinct. I've had several colleagues of mine who would come back to me years after cardiothoracic practice, cardiac surgery practice, and come back and ask me to teach them basics of anatomy, because that is what is required in the operation theaters. I've had one cardiac surgeon always talk to me. You anatomists, in the beginning, you tell us there are two chambers, two upper chambers and two lower chambers in the heart. Please never teach like that. Because when you open the right atrium, we are able to go into the left ventricle. Now, I'm reminding you of this. 40 years ago, the concept of an atrioventricular septum was something new. Earlier textbooks never taught us something about atrioventricular septum. It taught of an interatrial septum and an interventricular septum. But the concept of an intervening atrioventricular septum slowly evolved as more and more of embryological details were being understood. Similarly, there is so much coming out in anatomy, so much coming out in anatomy research, and probably 10 years later, there'll be something more for us to learn and understand. Let us not suspend that kind of research, but let us concentrate more on living anatomy research. And I'm sure anatomists as a class will never become extinct, and we will definitely have our pride of place. Yes, today we are at the crossroads, but with more of robotics, more of artificial intelligence, more of machine learning, I'm sure we have a greater contribution to be made, and we have a greater and a higher place to exist. Thank you very much, and all the best to all anatomists who are here. Thank you.
Nabil ma'am, I'm just requesting you to unmute.
Yeah. Thank you so much, ma'am, for such an enlightening talk. I think the chat box is full of praises for the talk. I would like to welcome Dr. Deepti Shastri, ma'am, for any comments or questions that she would have. I think we need to unmute Dr. Deepti.
Yes, ma'am.
Thank you, Dr. Nikhil.
Yes, ma'am.
Sudha Sashayan, ma'am, I have always looked forward to listening to your guest lecture. I feel privileged not just to listen, but to chair a session of a guest lecture, a brilliant guest lecture just delivered by you, madam. And I think you have touched the hearts of every anatomist by your first statement, when you have said that anatomy is yet to be explored. As you rightly pointed out, we constantly hear about this, that anatomy is a dead subject. And I think you have revived it today. You give hope to the young anatomists to come up with better research, research that has not been done before. Ma'am, during the Renaissance period, anatomy was exalted for its beauty by artists. And today, anatomy, you have mentioned, can be utilized, that is living anatomy, could be a source of inspiration for other fields as well. And anatomists can meander into other fields like radiology as well. There's just one question I wanted to ask you, ma'am. Since you brought up the issue of artificial intelligence, you said that technology is a useful servant, but a dangerous master. So how do we balance technology? What are your views about it, ma'am?
Thank you very much, ma'am. I feel nothing to beat the human brain. There are areas where many of us think that, we can replace even dissection with technology. But I probably am comfortable to be a little conservative in that area. Yes, in a larger scale, it's something like, I'll compare this way. Those days, you had tailors who specifically made a drape for you. But then we have come to the era of ready-made garments, and then you go to the garment shop where it is already available. Nothing like a specifically designed drape, when you compare it. Similarly, maybe when you have too many students, large-scale teaching, technology is useful. But beyond a level, it would be the in-house specific hands-on training that is required. I think we need to kind of balance. When it comes to intricate details, it is the in-house hands-on. But when it comes to gross applications, probably technology would help us.
Thank you for your wonderful answer, ma'am. Thank you, ma'am.
Thank you.
Thank you so much, Dr. Deepti and Sudha ma'am. I would like to request Ghatak sir for his comments and any questions if he may have.
Ma'am, congratulations for such an enlightening treatise on this particular topic. Actually, ma'am, over the years, to a certain extent, we senior anatomists are to be blamed for not having done enough for the young anatomists. So that is the reason we are standing at this crossroad today. Having said so, we to become if we have to be clinically very relevant, then only we can be of any significant or will be taken seriously by our clinical colleagues. In pursuit of this, I have done certain things like we have started a cadaveric skill lab where we have started some postdoctoral course, certified courses in neuroanatomy, where we have the anatomists as a faculty of we have created a faculty of neurosciences, and we have the anatomists as one of the faculties. So we have to evolve as anatomists so that we can offer more and more this thing to our junior colleagues so that they take up anatomy. There are so many other branches where we can branch off, like cytogenetics definitely is one of them. And we have to be clinically relevant. And nonetheless, ma'am, you have rightly pointed out a lot of things which we can still do to make anatomy very clinically relevant. Thank you so much, ma'am. Thank you for a nice talk.
Thank you, sir. Yes, I do agree that, we need to be a little more clinically vibrant. Probably senior anatomists have not thought of it yesterday, and we need to show and pave the path for the junior colleagues. But then it is not necessarily always areas, tricky areas and very minuscule areas like neurosciences and cytogenetics. I do agree. Neurosciences and cytogenetics are wonderful areas for us to dwell into. But then even gross levels, say for example, there is so much of changes which are happening in orthopedic surgery these days. Tendon extension procedures, and so many fibrous structures being utilized. Now, how much do we know? we had a kind of, at the Madras Medical College a few years ago, I think there's some, yeah. We had a kind of an interaction with the orthopedics department and tried doing some kind of study on the various fibrous structures which are in the nail bed region. You know, the fibrous structures, the ligaments, we just talk in terms of the ligaments. Yes, there are ligaments there, but then the direction of the fibers in the ligaments do matter. I think those are areas which can be even taken up, like, you know, apart from other areas like cytogenetics and neurosciences. It is necessary that we kind of make a link, let the anatomist make an inclusive domain, like, you know, strike a good deal with your orthopedic colleagues, with your surgical colleagues, and try and have a constant interaction. See to that the postgraduates are regular in visiting these theaters and trying to get some kind of material for them to research upon. And that would be an area where, you know, we can expand. Thank you, sir. Thank you for those wonderful comments.
Thank you so much, ma'am, for enlightening us further on how we can pursue the course of anatomy as an interdisciplinary team. I would request Dr. Anu Sharma for any comments or questions from her side.
Thank you for this wonderful opportunity for being here and making this Sunday so wonderful. Thank you so much, ma'am. You have shown us such hopes, and I mean, you have made our day. Anatomists are really proud to have you here. Ma'am, like whatever you said, and I had just one thing which came in my mind in addition to it, like you said, dance anatomy. And I was just thinking, yoga anatomy is also getting very popular nowadays. On my Facebook account, I usually see an ad of a person who's telling about the hamstring strengthening and things like that. And he is, you know, asking for subscription like that. So particular stretches and but a very particular group of muscles he is, you know, stressing on. So I found it very, you know, like I was thinking, why can't we do it? So today's talk, you touched upon that part. I'm so happy that all the anatomists are on the same wavelength. And as Dr. Ghatak also said, we are also continuing with many cadaveric workshops here. In collaboration with neurosurgeons, plastic surgeons. And there is one fellowship program which is going on in anesthesia over here in our institute. And their anatomy faculty is also a resource faculty. We teach them, we show them on the cadavers. So, I mean, yes, I totally agree with you that we should not make it dead. And as senior anatomists, I think we should take the torch forward. And I mean, there is a wide horizon for this anatomy field, but it is just that we have to do some effort and fight the resistance from the other people. Thank you so much, ma'am, for this scintillating talk. It's really, really a great pleasure listening to you. Thank you, ma'am. Thank you.
Thank you. Thank you. That one other area which we can think of is the skull base. You know, skull base is again a very, very difficult area, and the anatomy could vary also from one individual to another, depending upon the various pointers there. There could be some variation. So skull base is another area that the anatomists should concentrate on. Thank you.
Thank you.
Thank you so much, ma'am and Dr. Anu. Ma'am, there is a question on the chat box.
Yeah.
They have asked for is there any postdoctorate courses which anatomists can do after
I think Dr. Gattak was talking about some postdoctoral fellowship course. See, generally these postdoctoral fellowship courses are more of regional universities regulations. We can prevail upon the various universities and collectively think of certain postdoctoral fellowship courses in anatomy. Basic anatomist could dwell into these postdoctoral fellowship courses, and taking the cue from Dr. Gattak, I think I would also put in some effort at my university to have some PDF courses. Yes.
Thank you so much, ma'am. And now, if the time permits and the organizers permit, there is a hand raised. I think Dr. Sakarai Jayagandhi. If the organizers can unmute him.
I'm just requesting the person to unmute.
Yes, Dr. Jayagandhi.
Yes, ma'am. Good morning, ma'am. Sudha, ma'am. It's a very interesting and inspiring speech. Ma'am, I have only one query, ma'am. Last 20 years, I am in the teaching line. If you see that the anatomy teaching, so now we are motivating the undergraduate to concentrate with the clinical part of anatomy. But if you see that specialists from various departments, they're coming back to anatomy to learn the basics. They want to do the dissection. They want to do themselves the dissection to know the structures. But we are now in the century, the students are not doing the dissection and most of the topics are reduced, especially that ossification centers, the bones are not teaching. And if you see the histology part is reduced, embryology part is reduced. So whether we are in the right path, motivating the undergraduates, not learning the basics or fundamentals clearly, but we are motivating them to learn the clinical anatomy. But the specialists from various departments coming back to anatomy to do the cadaveric workshop to do dissection. So this is my query for long years, ma'am. Just want to know from your view whether we are in the right, how we are motivating the undergraduates towards the right path, ma'am. Thank you.
Thank you. I think this is a sentiment. I would take it not as a question, but then I would take it as a sentiment that most of the anatomists are reflecting today. Yes.
Yes.
Yes. I also find a comment in the chat box. Knowledge of gross anatomy will always precede its clinical applications. True. Unless I always used to comment, unless you know where exactly the radial nerve is passing by, there is no point telling someone like, injection anatomy, like, don't
Yes.
injection here and all that.
Yes.
Unless you know that, how will you know the clinical anatomy? But then we should also realize we have come to a kind of a stage where, we are trying to condense and compress everything for a period of about 4.5 years at the basic level.
Yes, ma'am.
4.5 years of your undergraduate medical course and everything has to go into that 4.5 years. Genetics is not the same as it was 3 decades ago. So much of, developments in genetics, and how much can we teach? So we probably, we are also forced by regulations. Given a chance, you and me would want anatomy to be there for at least 2 years at the basic level, 24 months. But then we cannot do that because we are not the policymakers. There are policymakers, and we probably will have to tow with the policymakers at some point of time. So there is a necessity that we prune at the undergraduate level. But then there is a definite emphasis on the basic anatomy with the cadaver skills lab coming up. People who kind of specialize, they come back to us. Everyone comes back. The ENT person comes back. The cardiac surgeon comes back. The skull-based surgeon comes back. The orthopedician comes back. Everyone is coming back. So we have to set the balance where at the undergrad level, we tell them what we now tell you is only a tip of the iceberg. There will be a time you will come back to us when you start specializing further. So it is necessary that we put that sentiment. It is not possible for us to give them everything. And mind you, we also have the questions of syllabi and curricula these days. Earlier, I always used to be intrigued with the word syllabus and curriculum. When somebody comes and tells me, when I was a little younger, when somebody comes and tells me, like, prune the curriculum, prune the syllabus, this is out of syllabus, my standard response would be, what is there in syllabus in human anatomy? Which part of human anatomy can you cut short for the sake of cutting short the syllabus? Can you cut the upper limb? Can you cut the lower limb? Or can you decapitate? I used to be irritated when people came and told me, like, make the syllabus smaller. I'll just immediately burst out with a very angry response saying, okay, fine. If you want to reduce the syllabus, decapitate and go. But then, taking the practical circumstances as you mature, you also learn that you need to reduce certain things for the undergraduates, but then impress on them that there will be a time when they have to learn the basics for the sake of specialization. It's a very, very tricky balance. And I think all of us learn, all of us grow. We grow as an anatomist, and probably all of us can think in terms of impressing upon the policymakers to make more of basics come into the undergraduate level itself. Probably that's a very, very difficult task, but then we can try to prevail upon them to include a little more time for basic anatomy learning.
Thank you so much, ma'am. The chat box is full of appreciation for your very, very thought-provoking, inspiring, motivating. I think we'll all be at a lack of adjectives to describe the talk. If if I try to summarize the big arena that you have opened in front of us, yes, there is a need for us to think about our existence as anatomists, to rejuvenate ourselves as a clan. And this very Sunday morning, this good Sunday morning has, you have inspired us to do that. And you elaborated that anatomists, despite having contributed so much to mankind, so much to intelligence, a large part of our vocabulary, as you said, in different languages is derived from anatomy. And it is still a fascinating science, still unexplored fully. But then this that was given to us, that anatomy is a dead science or only dealing with the cadaver. But in order to make ourselves move forwards from the crossroads, it is a imperative need now to rethink our approach. And as you advise, to practice living anatomy, explore the areas of facial anatomy, transplantation, fixation anatomy, and doing that, migrate towards interdisciplinary studies like sports, like Dr. Anu mentioned, yoga, and kinematics involved in dance anatomy, towards areas of non-interventional radiological anatomy. I think, like you said, the sky is the limit there. We go into investigative and diagnostic radiology and skull-based, like you later pointed out. So the need, as you mentioned, is to concentrate more on living anatomy research to continue making our relevance as the field of medicine progresses further. And like you mentioned, I think all of us would be having some or the other anecdotes of students coming back to us. So the pride of giving wings of knowledge to the clinicians can never make anatomists extinct. This pride will always be with us, and we should take pride in being that anatomist who is making that clinician a clinician. Thank you so much, ma'am. I'm really grateful to the moderators, to the organizers for making me a part of this session, and extremely honored to listen to you, ma'am. Thank you. Over to Dr. Nikhil.
Thank you, ma'am. Ma'am, we have Archana, ma'am, who has raised her hand. So, ma'am, we will just unmute, ma'am. There is some network problem, I guess.
I think.
Yes, the video is stuck actually
Yeah.
from ma'am's end. Just trying for 1 to 2 minutes more.
She came in and then I think
Yes,
now
yes,
he's stuck.
yes, yes. Actually, ma'am has raised hand since long time. So I just wanted to, but she's not able to connect.
Has she put something on the chat? I don't think so. No?
Ma'am,
Yes, Archana ma'am, please ma'am.
Okay.
Yes, ma'am.
Good morning, ma'am. It was a very enlightened session. I just want to ask a question, ma'am, that in the new curriculum, very important topics have been removed. Just as an example, the clavipectoral fascia. I just wanted to know that we should teach those topics which have been left behind from the ancient times. We have taught from my seniors, my teachers, and very important, some small topics have been left behind. So we should teach those topics to the students or we should not? Thank you, ma'am.
Dr. Archana, my take on this would be, yes, we should teach them, but then find the time for that. The major issue would be, when we start calculating the number of hours that is given in the regulation, very often I find there is a kind of a discussion between anatomists, physiologists, biochemists, because the first year where they are our colleagues, and then how many hours should we teach? I think at some point of time, we should forget number of hours that we are contributing. Yes, there could be times when we teach extra. There could be time when we put in more hours of work, but then that has a reward. That has a reward where your student becomes a good expert in the area, in the domain, and the pride of being a teacher. Generations later, you find your students come back to you. So I think we should find the time. And I don't believe in kind of, sticking on to the watertight compartments. Yes, certain areas have been left out. I'm also pained looking at that. But then, when it becomes a large scale factory of producing many medical graduates, undergraduates, it becomes like that. You will have to just keep to a general dictum. But then find your own time. Your students will definitely be impressed if you find the time and give them that extra knowledge. Yes, that is for us to balance.
Okay, thank you, ma'am. Thank you.
Thank you, ma'am. Ma'am, indeed, it was a wonderful session and enlightening one. We can remember your punchline from the lecture that anatomy can and should never be extended. I am also a young anatomist looking forward the career in anatomy. So I have myself being very enthusiastic now after your lecture. Thank you so much, ma'am.
Thank you, Nikhil. All the best to all my colleagues.
Thank you, ma'am. So we will be proceeding with giving the certificates. So first of all, I would like to present the certificate of appreciation to Sudha ma'am for delivering this guest lecture entitled The Anatomist at the Crossroads. Very apt title, ma'am. Thank you so much.
Thank you. Thank you very much for that wonderful certificate. Because, at any point of time, receiving a certificate gives a kind of joy and happiness. Thank you very much.
Thank you, ma'am. Next, we give the certificate of appreciation to Dr. Deepti ma'am for chairing this session. Thank you, ma'am, for your presence and valuable time.
Thank you. Thank you so much. I would like to thank the organizers of the 68th National Conference of Anatomy. And thank you, Sudha ma'am. I really felt honored and privileged to listen to you and your discussions with all the audience. Thank you, ma'am.
Next, we present the certificate of appreciation to Surajit sir for chairing this session. Thank you so much, sir.
Thank you, Dr. Nikhil. Thank you. It was indeed very nice to sit through this entire this thing of ma'am, and we really could relook at the revival of anatomy again. Thank you so much.
Last time, sir, we connected over a physical conference, and this time we are online. Thank you, sir,
Yeah,
for
I
your
know.
presence. Next, we give the certificate of appreciation to Anu ma'am for chairing this session.
Thank you so much. And it was a great honor. Thank you, Dr. Nikhil, and all your organizing team. It was a wonderful session, and we really appreciate Dr. Sudha's vision. It is really inspiring and motivating. And as you said, it's not the senior anatomist, I would just modify my sentence. It is the young anatomists who have to take the torch forward. And I'm sure that you will do it. And I wish all the best to the young and all my colleagues. Thank you so much for such a scintillating session, ma'am. Sudha ma'am. Thank you.
Thank you, ma'am. Next, we give the certificate of appreciation to Nabir ma'am for wonderful moderation of this session. Thank you so much, ma'am, for your presence.
Thank you so much, Nikhil. Thank you so much, Punita ma'am, and the organizers for calling Sudha ma'am, persisting despite her busy schedule and the rescheduling of the lecture that we could have this session today. Thank you for giving me the honor to be the moderator for this session. It was indeed a very, very inspiring session, and it forces us to look ahead, think, have some lateral thinking, make ourselves more relevant in the present scenario. Thank you so much, everybody. Thank you. My regards.
Thank you, ma'am. So that was the end of this session. So it as a wonderful session by Sudha ma'am. It was enlightening for so many young anatomists who have been joining us in this session. We can see the number of participants are keeping on increasing in this session. So now we will proceed with the scientific sessions as per the schedule, and the paper presentations and poster presentations as shared over communication over the WhatsApp groups. Thank you so much. I will be calling upon Punita ma'am to end this session. Thank you.
Namaskar. I think everybody is so inspired, motivated, and rejuvenated by Dr. Sudha's guest lecture. Indeed, it is going to bring changes in the minds of all of us. And definitely we are going to collaborate with the clinical departments in our own fields. Thank you so much, ma'am. Despite your ill health, you have come to to join this lecture to help all of us think in that particular manner. Ma'am, thank you so much. Really, we don't have words, because till yesterday evening, I knew that you are not keeping well. Bouts of sneezing, cough. I really convey my heartfelt gratitude to you, ma'am, from the organizing team, as well as from all the delegates who have been here to listen to your talk. Thank you so much, ma'am.
Thank you very much. All your wishes kept me in good stead. Thank you. Thanks a lot.
Thank you, ma'am. Thank you. I request all the delegates to please keep connected with us. We are going to begin with the paper presentations. We have 3 different sessions where you can enter the different rooms, the different topics like neuroanatomy, medical education, anthropology, gross anatomy. They have all been shared on the WhatsApp groups. So as per your choice, you may enter the different rooms. After 3 such sessions, there's going to be a lunch break. And then later, after lunch, we are going to have the poster presentations. I think poster presentations will be finishing around 4:45 or so. Then immediately after that, we will be there with you for the virtual tour of anatomy department of KGMU. And then we'll have a short valedictory function. So please stay with us for today as well. Thank you for everything. Have a wonderful day ahead.